Preamble uses continuous glucose monitors as part of our physical because there's some pretty interesting things to see sometimes. Honestly, most of the benefit of a continuous glucose monitor during our physical comes from everything that the patient sees in real time in the changes in their blood sugar from the things that they ate. It's just a bit eye-opening. These things that you're eating that you thought were healthy, shooting your blood sugar up to 165 or 170, and it wasn't a meal. It was what you thought was kind of a healthy snack. Well, that's nice. You can identify those. You don't really need those. It shows us how well we regulate our blood sugar, how much it spikes, how quick it comes down. These overall shapes and curves give us good insight into somebody's metabolic health. It can also be a source of stress. We've gotten calls from patients immediately after starting a glucose monitor. Hey, it's gone up after I've ate something. Is this supposed to happen? What's your blood sugar? Oh, it's 140. Like, yep, that's totally normal. Like, you eat and your blood sugar goes up. It's supposed to do that. And so this isn't to build some sort of fear and phobia against your blood sugar spiking up. It is to realize that you may have a bunch of things that you eat throughout the day that spike it up for no reason. Save those for your meals where you're eating good whole foods, and then forget about it. It's gonna have a great impact on the long-term effect that we're trying to get anyways. And so using it to improve your habits. Some people who have prediabetes or early stage diabetes, having that continuous awareness drives a level of organization and effort sometimes that really moves the needle on these people where it was never working. I've seen patients in their early 70s with diabetes completely reverse it, and they swear by using a continuous glucose monitor all the time because it keeps them in line. It helps with the discipline. That is by no means everybody, and it's definitely the minority of the people who would benefit from something like that. Other things that we see from a continuous glucose monitor, sometimes we see the blood sugar dipping in the middle of the night that correlates with when somebody's waking up. We're able to determine that, look, there's probably some drop in blood sugar causing a cortisol spike that's the source of all this. And so sometimes there's some tips and tricks of some food that you can eat before bed that improves all this stuff. Sometimes we see blood sugar spike really high in intense exercise. We have a lot of endurance type athletes who do a lot of activity, and they do not eat very many carbohydrates. The carbohydrates are the enemy, and they like activity, but they've gone a little bit too far the other way to where now their body is not expecting any sort of carbohydrates. When they do get it, you see these blood sugars spike up into the 200s, 250s in this otherwise super fit person. These are people who have really high VO2 maxes, lean body composition, but they always say, you know what, my doctor told me I'm pre-diabetic. My A1C is 5.7. Isn't that crazy? Look how fit I am. But it's an archetype, and those people actually need to eat more carbohydrates to feed their body a little bit better. But that's a different story. But those glucose monitors really help kind of bring this stuff out to light and help people make sense of it.